What can quantum physics teach us about our mental health? And what does a man of science think that the true benefits of AI and technology are to our overall well-being? Welcome to a special edition of The Mental Space, filmed here in the Leaders Lounge at Nexus at Expo City Dubai. Well, my guest today is a man with more than 24 years of experience. He's advised Dubai Health Authority and CIHA. He's worked in the US, Europe, and here in the Middle East, and often advises governments and organizations on how they can improve. Please welcome to the podcast, Mr. Mazin Gadir.
Thank you much for having me, and Ramadan Kareem to you and your audience.
Ramadan Kareem to you as well. A great time then, as we reflect in the holy month, to ask you the first question that we always ask on our podcast, which is, what does mental health mean to you?
Wow. Mental health means a lot to me. Having gone through a lot of experiences at work, at home, within my family sphere, it means a lot in the sense that it's my pathway to success. Managing my mental health, making sure that I'm well versed and well established with understanding the weaknesses and the strength of my mental health allows me to progress and elevate my ability and perform better. So for me, mental health means anything from the physical requirements, sleeping well, eating well. Mental health means engaging with people in a very decent and transparent manner. Mental health means looking after myself from a positive energy perspective, and always be grateful. Whenever I think of mental health, I'm thinking of gratefulness, what my parents did to me and what my friends and mentors and coaches and career advisors have done to me for the last 46 years, drives me to elevate and power up my energy and drive through. That's what mental health means to me.
How has those personal experiences shaped you then over time? If you can share some of the ways that's impacted you and driven you on your professional journey, because often we'll focus on someone's academic or professional development, and we'll come to your story on that journey. But give me a sense of, you've referenced them there at the top, how those personal experiences have shaped your perception of mental health.
Absolutely. It started with my experience with my father, who has been a positive impact in me. So my parents left Sudan back in 1975 and moved to Abu Dhabi. I was born in 78, and I grew up in Abu Dhabi in the first part of my life. For almost 18 years in Abu Dhabi, my interaction with my father and the community of teachers and students and friends in the Abu Dhabi city back in those days was or had a lot of impact on my mental health, on my personal identity, and as well as it helped me shape up who I am now. I got influenced a lot by my father, who has been God bless his soul, he was a positive mark in my life. He's been always a great influencer and positive driver for who I've become. I believe also my teachers. I've been influenced by a lot of great teachers in the public school that I used to go to in Abu Dhabi. They have the generosity of their kindness, their advice that has lived with me throughout my student life and career, their positive energy that has grown into me for the length of my my path since I've left school. So I think my biggest interaction with my father specifically, my teachers and school, let's say school teachers who have influenced me specifically on how to be a good professional, a good person in the community, give and not take, offer help and kindness, and always give the benefit of the doubt, and be a good person in the community. And obviously, the religious and spiritual sphere that I've actually grown into has also influenced me to um, be who I am now, and try to guard my mental health in order to progress and pivot with my career.
I'm going to come back to you on your tips or how you got your mental health. But let's focus on your career for a second, because you start out as a quantum physicist.
Yeah.
I've heard you speak previously about how you got into healthcare almost by accident. Tell me about that journey from, quantum physics to healthcare and healthcare innovation.
Sure, absolutely. So, I mean, again, one of the influences of my career and my life was my supervisor, Dr. Paul Harrison, in the University of Leeds. Yeah. I was an undergrad, and I was doing my electronics and electrical engineering program. And he lured me by enticing me to do a research project in my final year of my undergrad on quantum lasers.
Quantum lasers.
That's right, and that started me in getting very curious and excited about the concepts of quantum physics and the quantum world, where you don't talk just about the atoms, you talk about the subatomic structure, you talk about electrons and protons and the movement of electrons within the atom and how it actually creates science out of the whole dynamics of that.
I can see you getting excited just talking about it.
Absolutely. Even though it's been 25 years, but it gets me always excited and aroused because it's a beautiful world of science that I got into. The bottom line is, or the short story is, Dr. Paul Harrison came to me after I was visiting multiple doctors when I heard I got a scholarship to do a PhD. And he said, listen, Mazin, you want to make money and you want to enjoy your career growth, join my PhD program, and I will get you to learn all about quantum electronics that nobody heard nothing about it. So I was like, yes, more money. And as a student in Leeds, I was like, okay, more money means more happiness. So I jumped on his ship and I started learning about quantum physics. Little did I know that the research project was on cancer devices built based on the quantum physics science. And those quantum sensing devices are state of the art, where they can detect cancerous cells without omitting any radiation on the body, in the human body. And that's where the story began. Those devices got me into healthcare.
Fast forward 24 years, you've worked as a senior advisor with Dubai Health Authority and with SIHA. I know you've worked at the Sunnah Institute as well.
That's right.
With that experience, what has quantum physics taught you about the human condition? What's the line that you can draw from quantum physics to mental health?
I think the concept of energy spheres. Well, quantum physics taught me that there are energy pockets within us. And these energy pockets can be activated to actually positively attract and emit energy. And this is the basis of my mental health ethos, I guess, is the concept that you can go down to your atomic structure within your body. Every cell that we have is made out of atoms, and every atom has an amazing amount of photonic energy that dynamically moves things within our cells. And by the way, if you reflect and you actually guard those energy pockets and direct them into the right way, you are able to activate yourself within the personal sphere to be always a positive energy emitter. And then you attract those who drive the energy that you give out to even build upon your energy. You become a multiplier of energy. And with that positive energy, I believe you are able to drive your performance, your productivity, your human engagement, and tackle all the pits and falls that we have in our daily activities when it comes to either lack of sleep or depression or sad news or any sort of unprecedented pieces of information that might affect us mentally. So I think the quantum physics, mental health, the energy sphere is what connects that.
Amazing. We're both members of the British Chamber of Commerce Dubai Healthcare Committee, and you're always our go-to expert. You're at conferences around the region, you're across so much research, and you're always having conversations with people within government. As you said before, I know that you've worked with the Dubai Health Authority, you've worked with Seha, that's doing amazing work. Tell us for a second how you see the direction of travel here in the UAE. What does society and what does the private sector need to understand about what's happening regarding mental health in this country?
Absolutely. And I think the coming 5 years to 10 years, the private sector have to play a pivotal role in driving mental health guidelines and practices, especially in this region. You know that the economy here is quite flourishing, and it's thriving in the next coming years with a huge amount of support and drive from the government, and the critical accountability and the critical part that needs to be addressed and focused on is the private sector playing a pivotal role in driving the mental health mandate to help productivity and help their employees being protected as well. And we've learned that from COVID, and COVID has been a huge learning incident for us that lasted for many months, but it showed us that without your human capital, right, and guarding the mental health of your human capital, you're not able to perform. Having actually worked with the British Chamber of Commerce in the healthcare roundtable, we have seen the emphasis on the mental health of the workforce climb up the ladder to become one of the biggest issues and concerns and risks that the industry has been afraid of. It has become a critical threat to the survival of the industry. And as we know in COVID, healthcare is a pivotal national security pillar of any country. So when your workforce is at risk, your industry is at risk, your nation is at risk, and you can apply the same ethos and thesis across other industries. If you look at aviation, pilots go through a lot of stress. And aviation need to actually pivot with their compliance policies, with their procedures to try and safeguard their pilots from the huge stress and pressure that they go through, specifically as they lead activities that are critical, when you're transporting hundreds of people across. So to summarize, what I wanted to say is, I believe the private sector role is yet to be unfolded, yet to be realized. The government has been instructing, has been throwing out a lot of strategies, mental health strategy. They are putting a lot of wellness, focus on wellness and employee happiness and customer happiness. But it comes back to the private sector to activate as they play a bigger role in this economic growth in the next 5 to 10 years. The private sector have to step up and come up with practical use cases and procedures that can be shared, can be recognized and celebrated.
Now, we've talked about this, and we talked about the risk versus reward. And I know we've had previous conversations on different stages of different conversations. So we look at the economics of the UAE and indeed this region over the next 5 to 10 years. It can be an economic miracle, in terms of productivity. We see both here in Dubai and in Abu Dhabi. So at a government level, the new mental health law, which makes it illegal for employers to discriminate against employees with mental health conditions. We see the Dubai Health Authority launching the mental wealth framework, again, trying to encourage the private sector to embrace the well-being of their employees. We often say it's good business to be a good business. What's your view on the rewards on offer? Because we talk about the risk, we talk about the cost of business, we've talked about, what that could mean, but what's the rewards on offer for the private sector if they get this right?
I believe it starts with the private sector will win by, if they get this right, they will win by attracting the right talent. Talent will flock to those companies and organizations that have a mental health aura or sphere,
Energy, even.
That protects them.
Yeah.
Right? And this is a big war at the moment across all industries, the war for talent.
Yeah.
And with talent comes productivity. And productivity comes profitability and revenue. So it's an easy equation.
Yeah.
You behave as a company in the best interest of your employee, specifically mental health. It's not about money. And we all know that people leave companies because of people, right? And leave people actually join companies, not just because of the money, because they have a purpose and they feel protected. It's a family feeling. I would actually want to be working in an organization that would care for my mental health on a lower salary if I have to.
It's fascinating because earlier you remember you said you used to think that more money equaled more happiness.
Yes.
How's your perception of that changed?
Completely destroyed. It's not more money, absolutely.
More money, more pressure.
That's right. More money, more pressure. More money, more problems. Like Biggie, he said that in the song, right? So, but I think it's about acceptance and kindness that brings happiness. And again, we're thinking about organizations that are kind and wellness driven organizations.
Yeah.
Those wellness driven organizations are going to be the points of attraction to talent, even to good business. You will see that they will be getting the right amount of clients who would appreciate companies with wellness mandates, with employee happiness mandate, and clients are become much more mature in these days in UAE and the region to witness what is a company with toxic culture versus a company that thrives through wellness.
Now, you're a man of science, and I know that you are heavily invested sort of intellectually in how technology, AI, innovation can drive healthcare and value and general well-being. I'm sometimes a little on the fence on technology because we've seen how social media has some of its impacts, particularly on our younger generations. What do you see happening in this country, and what do you see as the real benefits? What are you seeing that is helpful to us and our mental health in that innovation space?
Oh, so I think, look, the UAE has positioned itself to be a leading nation globally in seeking the latest trends of technologies and adopting this at a very fast pace. I believe marrying the latest advancements, AI, Web3 and Metaverse, and bringing mental health into the midst of that would be the next pivotal point for the UAE.
Okay.
Is how do you actually bring those AI use cases and implement, not just for a proof of concept, but also to scale up. And whatever data you're collecting, you can build so much research on top of that. I believe that we have the right mindset, leadership mindset.
Yeah.
We have the right vision and strategies that have been set up on a government level with the right participation and collaboration of the private sector to marry the technologies where we are advancing fast in to the concepts of mental health and wellness that the country has set up a lot of great initiatives and frameworks for. So the marriage between those two would be the focus of implementing and scaling up proper guidelines, procedures, and use cases in the coming years.
Guidelines. Tell me about that. I mean, if we look at globally, there is mass adoption of AI. You know, and we see some podcasters out there who talk about, you know, the rise of AI, and we've got the Terminator philosophy that they're going to rise up and, you know, conquer the world. Yeah. But when we look if you look practically at Web 2.0, when we looked at social media, we weren't even thinking about the unintended consequences of technology. For the first 5 years, it was just pure exuberance about this new form of connectivity. And only now are we really beginning to understand that guardrails are needed, that it's not necessarily all pluses. There are some negatives, and we need to try and find that middle road. How do we build in, because there's so much exuberance now around AI, and if we look at the economics of the world, it's one of the solutions to productivity around the world, not just here in the UAE. But how do we build in the ethics, the guardrails, the humanity in all of this? Because that's sometimes my concern around technology is how do we make sure that it's still a very human piece of technology, as opposed to it's just all pure algorithm.
And I will call upon a very important player in this realm, research institutes and academia, because that's where we need the psychologists and the psychiatrists, the research hub to come in and humanize our use of AI and try to rationalize that. There's a lot of talk, a lot of work around the AI implementation or AI concepts being implemented across multiple industries, but we still need to make sure that we need to marry research and academia into this in order for us to understand the impact, number one, on how AI is changing our ways of life. Number two, our behaviors, how are they being altered by the use of AI when it comes to either productivity or human-to-human interaction? And what is the impact and the outcome of the excessive use of AI and digital on our mental health? Because this is an important area that needs to be measured. It might backfire on our productivity, or at least on our social intelligence. So as we've progressed in artificial intelligence, we are in need to understand how do other intelligence forms would actually marry or come close. Social intelligence, emotional intelligence, because the emphasis on these other concepts when it comes to our personality, our human-to-human interaction, need to be closely monitored with the excessive use of AI. So the role of research, and we need to study this, we need to actually come up with use cases and bring in the right academic and research institutions that would help us to see how can we also move the community aspect alongside it. How do we move the personal aspect and look at the psychology and the psychiatry of the different areas that would come in as we continue using AI across multiple industries. So I think the role of research and academia is pivotal here.
Okay. Well, give me some examples of projects, initiatives that you're seeing that excite you, that you think that genuinely going to make a difference.
Look, I think one of the areas that I have been so excited about the work that has been done in Abu Dhabi. Mohammed bin Zayed AI University has been doing a lot of great initiatives in trying to not just implement AI, but they actually try to study the use cases and concepts of AI from different angles. And definitely the psychology of it or the sociology of it is a pivotal part. So I've seen some of the work that they've done specifically in looking at certain use cases, whether it's the marriage between AI and some industry concepts. And they allow the researchers to come in and study also the human impact, the human factor of it. Another concept that I'd love to actually bring to the surface here, a very interesting AI project that Dubai Health Authority has actually started previously, and they were looking at, for example, the use of AI tools for retinal scanners for diabetic screening. Very simple use cases that started back in 2018 and is being surfaced back again and again. And we're looking at not just how the outcome has been achieved in terms of reducing the time required for screening diabetic patients, but also you're looking at how the radiologists are actually getting more time now to spend with the patients. How is it affecting their burnout? Is it reducing the burnout, reducing the long hours? And this is very key in some of the projects that are coming up now, is studying the impact and the outcome on productivity, but also on personal growth or human interaction. People are spending more time, especially in healthcare. Some of the use cases have been implemented in AI, and the patient-physician engagement has been improved and studied to actually allow more.
Because you sometimes think that more technology means less connection, less human connection, less face-to-face connection.
That's right. And that's the concept. Now we're looking at the latest AI models, especially the voice AI, voice-to-AI capabilities that are being developed now. We are talking a lot now about the implementation of voice-to-AI capabilities that allows physician more time to spend with the patients, but also reduce the workload on the physicians who have been suffering from burnout, depression, suicidal tendencies.
Absolutely. Well, I mean, when we look at mental health in our frontline services, there's a real cost to all that caring that's happening.
Absolutely. Absolutely.
We talk about burnout, and when we talk and catch-ups with the BCCD healthcare committees, I see how many, conferences, how many pieces of research you're across. I wonder how you don't burn out, because you're a busy guy. And I'm really grateful you've taken the time to sit down with me today.
Thank you.
So you talked about, how you take care of your mental health. What are the fundamentals of that? What do you do? Is it really interesting hearing a man of science as well talking about spirituality and energy, which sometimes might sound a little woo-woo to some people, but at the same time, incredibly important. But how does a man of science look after his mental health?
So I think the main superpower, 70% of our superpower rotates around sleeping.
Okay.
So you manage your sleep well and make sure that you are sleeping enough. Because you're recharging. You're like a battery at the end of the day, and having the right number of hours and early sleep would actually recharge those batteries. So sleep is something that I've researched and I've studied, and I've actually been mentored. Because people have actually alluded to the fact that your sleep is your superpower. That's number one. Number two, I would say also your nutritional intake, your diet. The way, I think fasting is something that allows you to regenerate. And we were in a very good session during the Arab Health called the World of Wellness, where we talk about the biohacks.
Yeah.
Right? Fasting is so, you hear of intermittent fasting.
Indeed,
or complete Ramadan's fasting.
Yeah.
I think that helps you to manage your diet. So sleep and diet is basically two major superpowers. And then the third point that I always remind myself of is gratefulness. The gratitude, the power of gratitude, whether it's gratefulness to the people around you, the family that you have, your workplace, and those who have actually appreciated you. Gratefulness is a powerful ecosystem. It allows you to dive in and lose yourself in it, and it generates so much energy when you come out of it. So being grateful for the life you have, for the family that you have, for the health that you have, drives you to tackle all the challenges that you have.
I'm going to ask you to mentor me a little bit on some of those. If we start with your last example there of gratitude, that's not easy though at times, is it?
True.
Particularly when, we look around the world, different people have different challenges, but it sometimes doesn't matter whether you're a CEO or a security guard.
True.
Everyone faces these challenges. How do you, and you, I'm sure, have your challenges. How do you maintain, how do you stay grateful in those times when life seems against you a bit?
Sure, that's a good question. So the key for gratefulness is charity. The more you get involved in charity, volunteering allows you to dive into gratefulness frequently. Everybody goes through ups and downs. Everybody go through up and down, through ups and downs. And we constantly have pit stops and falls that we need to come through. I believe the more you get involved, having a like an artificial schizophrenia, I say it, the dual personality, where you are at work and your family, and that's great, but you also have your volunteering personality, where you volunteer in charity, whether this charity could be helping the needy or supporting mentoring students, whether it's actually giving back to the community. This charitable activities that you can get involved in allow you to stay in a grateful mindset frequently. And I believe that's one of the key things that I've learned in my life. The more you volunteer, the more you do charitable, and it doesn't have to be monetary or financial. It could be effort, it could be knowledge, it could be giving back to the community. It could be writing articles about useful topics for people to read. So knowledge sharing. So having that art and act of charity allows you to stay the longest in the sphere of gratefulness.
That almost feels like a mic drop moment, particularly as this year, obviously, the president of the UAE has declared this as the year of community.
Absolutely.
And how important community is to our mental health. Absolutely. And I'm going to stay with that just for one question. How important is community to you for your mental health?
Absolutely. Community is a critical support system for me. So it helps me a lot. Community, from my little unit, family unit, to my relatives, to the community of my fellow nationals, to the community of my friends and colleagues. Having communities of support is critical and pivotal for maintaining a healthy mental health mindset, as well as maintaining a gratefulness state. Because when you are in the community of people that you really enjoy, you draw a lot of energy in and give out energy. And that exchange of energy, allows you to pivot. So I think it is critical for every person to start developing these communities of support, from the family to the friendships and colleagues that can actually bring you out of the sphere of work, out of the sphere of your the challenges that you go through.
I love how it keeps coming back to energy and quantum mechanics
absolutely.
again.
I'm a physicist, by the way. So
physicist,
energy is important.
Yeah.
And it's true.
I'm going to ask you to mentor me again as well, because you said you were mentored, and I'd like our watchers, listeners, to take some practical tips away. You talked about sleep.
Yeah.
And this, every time I do one of these podcasts, my daughter wakes me up at 2 a.m. in the morning, every time I do one of these podcasts. But in terms of sleep, what did they teach? What did your mentor teach you about how to actually ensure a good night's sleep?
Sure. Very simple advices, right? Start with leaving the mobiles in the living room.
Okay.
Right? Leave all the devices outside in the living room, right? That's number one. Number two is get in bed early. So every hour before midnight is counted as 2 hours after midnight. So your body actually rejuvenates so well before midnight, and hence try to squeeze in as much as or as low as 1 hour before midnight, because that's where your body goes into the deep sleep.
Okay.
So complete darkness of your room, that
complete
you have
darkness.
to ensure.
I've heard that before,
I think these are the basics that I go with. Making sure that no devices are there. Making sure that you have a good mattress and a good pillow, because you don't want any aches or any body aches as you sleep. And make sure that you have left not just the digital devices outside, but also leave your work and your brain outside. Make sure you completely are disconnected. Obviously, with the setting of the room, and make sure that it's completely dark, and have at least an early sleep. 9, 10, or 11. At least you're in bed, and then try that 5 times or 5 days at least a week. With the
try
exception
and build a habit.
Exactly, make it a habit.
Yeah.
So try it, and make it a community habit. So your family can actually do the same. Yes, your kids can go to bed early, but also you and your spouse would actually try it as well, where you get up so early at 5 a.m. One of my mentors is actually Dr. Reinhold. He's a urologist in American Hospital Dubai, and actually I've been seeing and monitoring his pattern. He sleeps early, gets up at 5 a.m. and does a lot, a bit of spirituality and exercising and whatnot. And I definitely looked into that, and I managed to adopt as much as possible.
Are you a member of the 5 a.m. club?
I'm a big member now because of the kids, right? So for the last 10 years now.
Not by choice.
Not by choice, by force. So I had to change my behavior based on that. But again, getting to sleep early is, again, if you're a football fan like me, where most of the matches are really late, you sometimes have to watch the summary or the highlights afterwards. You have to give in.
I'm a bit like Columbo, if you remember. We always had one last question. So not one last question, but you talked about devices. As a fan of technologist, as a again, an academic that understands the benefits of technology, I'm going to ask you the direct question, which is social media good or bad for our mental health? And what's your advice on that?
Look, I think there is a bit of both. It might get very addictive, and you might be hooked onto it. But I believe also small portions of it might also help. I can admit that I'm an addicted social media freak, specifically LinkedIn. I'm a big fan. The amount of education and knowledge that I've been exposed to in LinkedIn are humongous. Plus, I'm a bit of a social butterfly. I love socialization, and LinkedIn has been my tool to connect with as many people and as far as possible. What my advice is it might get too addictive sometimes, and you have to kind of manage your time. You have to use time management to its core to manage your exposure to LinkedIn and allow to limit yourself. And by the way, I see that in my kids as well. I have 3 kids, and all 3 of them are like YouTubers, and and the eldest is 10 years old. So I'm seeing a lot of difficulty now in trying to scale it down. And I managed to get some help by getting them into football or horse riding or bowling or something like that.
IRL.
Exactly. IRL. But that's the thing. It can be very addictive. I know Facebook and TikTok is another world, and I try to limit myself because I'm so into LinkedIn. I managed to kind of limit my exposure to Facebook or TikTok or Twitter.
I've now actually deleted Facebook and Instagram off my mobile phone. I still obviously access it via the laptop for professional purposes, but I guess I'm with you on LinkedIn because it's all linked to our job profile. Yeah. So there's a degree of accountability. Yes. So that, I think that brings in a degree of civility.
Good point.
To it. But also, as you say, it's more educational and networking in terms of career than anything else. I think the thing that concerns me about the Facebooks and the Instagrams of the world is obviously it's that algorithm that just takes you down that rabbit holes. Doesn't expose you to anything outside of what you're already seeing. And if it's if you're after celebrity, then you end up doom scrolling on celebrity for but then also there's the negativity. Absolutely. There's the commenting. Absolutely. Whereas I guess LinkedIn, it's social media, but it's different, isn't it? It is that.
And I think guarding yourself with ethical guidelines.
Yeah.
So obviously, no smearing,
which is easier done on the Twitters because it's not linked to your professional career. So there is that lack of accountability.
Correct. And I keep reminding myself, I use Twitter, for example, for government announcements.
Okay, right.
Or conference wrap-ups or, summaries. I use Facebook for condolences and death and marriage, either condolences or recognitions and congratulations. That's how I limit myself. Yeah. In basically,
it's kind of where we kind of came in and started with. It was family connectivity, rather than endless doom scrolling through.
That's right.
Arguably fake news.
Absolutely, and again, it goes back to your personal entitlement. How much time do you give yourself? I'm allowing myself.
Do you limit your screen time?
I limit my Facebook time. I go down to the social media. So I try to, for example, view Facebook once a week for 2 hours.
Okay.
right?
Yeah.
But LinkedIn, I have an 8 hour per day, for example. And I say, okay, 8 hour per day sporadically. I get up in the morning after I shower, I talk to the kids, I look at LinkedIn, what are the latest updates?
Yeah, of course.
Right?
Yeah.
So it depends on the social media channel that I want to focus on, which always comes to me as LinkedIn. And then Facebook to see on my cousins or my family who are spread around. The war in Sudan, I want to make sure that they are okay.
Yeah.
You know, Egypt, how's the family doing? Their weddings and da-da-da. And then Twitter, I'm looking at the government portals. What are the latest updates, strategies? And then I think TikTok, I'm still till now, haven't even downloaded TikTok. My wife keeps telling me off about it. But she shows me, for example, this is the latest wedding of your cousin in TikTok. Okay, and this is, your other friend who just graduated from TikTok. So I'm like, okay, I'm good as a secondary user.
I'm a terrible dancer, so TikTok's not my platform.
But my kids,
I'm sure you're much better.
Absolutely, my kids are crazy on TikTok. Now me and my kids, we play a lot of PS5, PlayStation.
Okay.
We're addicts. So my kids will use TikTok to show me the rating on certain games or certain movies when we go to the movies. So
this is them trying to convince you that they're allowed to play GTA or something.
That's right, exactly. Without the sound, though.
I'm going to give you a final question, and you've been really, really generous with your time. You spoke at the top of the podcast about the importance of your father and how he taught you. What would be one or two of the most powerful lessons that he taught you?
Look, I mean, there is a word that I love about him: kindness. Yeah, I mean, my father came to the UAE in 1975 and retired in 2005 and passed in 2010, passed away. God bless his soul. He's the kindest person I've ever seen. I mean, you can be angry. I mean, I've seen him in situations where people are angry and either swearing at him, and he just calms down and takes it easily. He doesn't react in anger. He managed to control his anger so well in front of us and in front of his friends and colleagues. And that's the key part here that I've learned from him: kindness, controlling the anger, and you know what? It's always gonna be okay. Well, no matter what you choose, whatever path you choose, it will be okay. As he keeps telling us this, and I can remember this till today. Just the first thing he always told me when I was Leeds University, because I joined Leeds when I was 18 in Leeds University in 1996. Yeah. I was crazy because Abu Dhabi was a beautiful city, but limited in its entertainment. When I moved to Leeds, it was crazy. And he's like, Mazin, do whatever you like, but number one, you need to look after your health.
Yeah.
And number two, you need to look after your health. And number three, you need to look after your health. Anything else can be doable. If you want to go out, you want to, do sports, you want to travel, you want to club, you want to go crazy, make sure that your health is your priority. So his advice kept me going. And I'm now using the same advice to everybody else: is your health is your wealth. Money comes and goes, career comes and goes, and you make sure that your health is intact, because your health builds your personality, and your personality builds your community, and your community builds your achievement.
That definitely feels like a mic drop moment. Mazin, thank you so much for joining us on the Mental Space podcast. I've been wanting to have this conversation for a long time.
Thank you.
Now, if you've enjoyed this conversation as much as I have, please remember that you can subscribe. If you're watching on YouTube, the button's just there. It'll take you 10 seconds, but it really helps us grow and bring amazing guests like Mazin to the podcast. So Mazin, once more, thank you for joining us.
Appreciate it. Thank you. Thank you much.